Joining us from Capitol Hill this morning is Congressman Suhas Subramanyam, who is a Democrat of Virginia, serves on the Oversight and Accountability Committee, here to talk about the stopgap measure. Congressman, the vote will happen today on the GOP plan to keep the government open until November 21st. How will you vote?
I'm going to be voting no, and I think there's a lot of reasons for that, but mainly, they've been continually cutting both the government workers in my district to their jobs, as well as funding to critical research and critical programs. And they have not done anything to restore the cuts they've made to healthcare, or restore the fact that we may be losing the ACA tax credits. That means doubling or tripling people's premiums. And so, this is a dirty CR, and I'm not going to vote for it.
There is reports that GOP and the White House are quietly connecting with some swing district House Democrats in hopes that they can get them to vote for this. What is your message to your colleagues?
My message to my colleagues is just to vote however you feel is best. It's pretty clear in my district and in Virginia that the Republican policies have been a complete failure. Not only are they firing people left and right who did nothing wrong and who are actually very critical to our country's running, but they've taken away Medicaid benefits, and hospitals are starting to shut down, and clinics are starting to shut down. And so people in rural areas, people in even urban areas are starting to see less access to care and more expensive care as a result. And if they don't continue to do this, it's going to be a disaster for Virginia. So it's a pretty easy no vote for me, and I think much of the Virginia delegation.
What would you like to see instead? What is the alternate plan from Democrats?
I'll say this: the Republicans have not made any effort to come to us. They've not made any effort to look at how they can address what could be a looming healthcare crisis. They have not done anything to address the fact that these cuts and these firings in the federal government have meant that many critical services to the American people have been decimated. And so I'd like to see them address those things in a meaningful way. And but they haven't made any effort. And so it's really hard for me to sit back and vote yes on something that's really bad for the American people and causing a lot of pain.
Senate Democrats have put forward a proposal that they would like to see on the floor, and they want the Republicans to negotiate with them to get their votes over in the upper chamber. The New York Times notes this morning that their proposal would add well over $1 trillion for Medicaid and other health care programs to the stopgap spending. Are you comfortable with that price tag?
Let's be clear, the Republicans over the summer with the big ugly bill cut $1 trillion in healthcare alone from people, and gave that to the wealthiest corporations and individuals, who many of whom didn't even ask for it, really. And so what they're trying to do in the Senate, it seems, I haven't looked into the details of the proposal, but what we're trying to do is basically restore that injustice that happened over the summer. And it's been deeply unpopular all across Virginia, and I think all across the country as well. And so I think what they're trying to do is right a wrong, and so I'm glad that they put forward a proposal as well. I mean, I've been very clear and very simple. When you restore health care to the American people, the cuts that you made, that you gave to the largest corporations, and then do something to stop the firings and freezes that are happening in our federal workforce, especially in Northern Virginia.
How comfortable are you, or do you have any concerns with a shutdown actually occurring if no agreement can be made between the two sides? Are you concerned your party will be blamed for it?
I don't care about the politics. What I do care about is the pain that it will cause to my constituents, because many of them work in the federal government, many of them may be furloughed. I'll say this though, I've had several town halls now where federal workers have come to me and said, shut down the government, use your leverage, because what's happening right now is they're already shutting down the government in a different and more dangerous way. And so use your leverage when you do have it. And so that's what I plan on doing, is I plan on listening to my constituents who have told me to use my leverage and shut it down if I have to.
The Washington Times headline this morning: House members' monthly spending allotment for security temporarily doubled. That's included in this GOP plan to keep the government open. $30 million additional dollars for security for you and your colleagues. Is it necessary?
Unfortunately, it's becoming more and more necessary. And it's not for me and my colleagues. It's for the safety of everyone that attends all of our events. It's for the safety of the people around us. It's for the safety of our communities and our families. The other day, I had security for the first time ever since being in elected politics. And the people at the events I was attending thanked me for having security, because otherwise they would have felt less safe that I was there. The hallmark, the bedrock of our democracy is making sure we can protect free speech as well as protect those who want to step up and get elected, no matter what they say. And if people can't access their elected officials, and if their elected officials feel silenced or threatened in any way, then that is a deep cut to our democracy. And so I want to continue to make sure people feel safe in my office. We had a threat to my office, for instance, a couple weeks ago, and I filed a protective order against the individual. We're taking all threats seriously, but we need to keep our public spaces safe, and certainly I want to keep my office safe and my events safe.
Congressman Subramanyam here to take your questions or your comments this morning.